Good morning, it's Dr. Afshin Emrani on my way to work, and I am getting so many emails and messages at work asking me if patients should be taking aspirin or no aspirin. So the question of aspirin and no aspirin came out of the American College of Cardiology meeting, the ACC meeting, and it made headline news that people should not be on aspirin, and it's the farthest thing from the truth. First of all, the document was a large document for prevention of coronary artery disease. And I want you to understand the difference between primary prevention and secondary prevention. Primary prevention is somebody who has never had a heart attack or a stroke or a TIA, and you're trying to prevent the first heart attack or stroke or TIA. The secondary prevention is somebody who's already had a heart attack or a stent or bypass surgery or a stroke. So they've already had an event. You're trying to prevent the second event. So primary prevention is preventing the first event. Secondary prevention is preventing the second event. So in people who have had a heart attack or a stroke or a TIA or whatever, those people, nothing has changed. You have to continue taking your aspirin if that's what your doctor told you. If that's what you're on, that's what you need to be on. So whatever it is, aspirin, Plavix, all those things, you need to continue with that. The question came up for people who are for primary prevention, people who have never had an event, should they be on an aspirin or not? And the answer is it depends on your risk factors. First of all, the document went over lifestyle modification that we've talked about at length, which means eating more vegetables, eating more fruits, vegetables, salads, legumes, nuts, all the good whole food plant-based stuff that we've talked about. But in addition, eating less red meat. In addition, walking, making sure your blood pressure is under control, 120/70, making sure your diabetes is under control, making sure that your waist and your weight is under control, all of which I have already talked to you about. Making sure you're getting enough steps in a day, activity is very, very important, and quitting smoking. Once you've done that, then the question is whether you take aspirin or not. So the question of aspirin really comes down to what are your risk factors. If you are an otherwise healthy person, then you don't need a risk factor. You're not on any medications, you're not diabetic, you don't have high blood pressure, you don't have high cholesterol, you're not a smoker, you don't have a very strong family history of heart disease, then you don't need to be on aspirin. But if you have multiple risk factors, for example, I consider diabetes the same thing as coronary artery disease, so all diabetics should be on aspirin if that's okayed by your doctor. But people who, for example, have plaque on the carotid arteries, or who get the calcium score and the calcium score is greater than 100, all of these people should be on an aspirin a day. So it really is a discussion between you and your doctor. You have to identify what are your risk factors. If your risk factors are high, you should still be on aspirin. If it's for secondary prevention, you should still be on aspirin. But a small subset of people who are very healthy and you're just using aspirin for prevention, then those people don't need it. Okay, so just make sure you have a discussion with your doctor and consider what your risks are, and then your doctor can point out to you. But more important than anything is managing your weight, making sure you're active, making sure you don't eat sugary drinks, no processed meat, and tons of vegetables, fruits, salads, legumes, and seeds. Love and peace.